Okay, hi everyone. My name is Megan Dean. I am going to be talking to you guys about ameloblastoma. I was recently diagnosed with this about 6 months ago, and I had to undergo a pretty major surgery and recovery, so I consider myself an expert, and a lot of people don't know about this disorder, so I wanted to talk to you guys about that today. And so to preview really fast, I'm going to be going over what is ameloblastoma, what are the cause and effects, and then what are some of the treatment options. Okay, first of all, what is ameloblastoma? So according to NORD, which is the National Organization for Rare Disorders, ameloblastoma is a tumor that grows anywhere in the jawbone region. So 80% of these tumors occur on the lower jawbone, which is called the mandible, and the other 20% occurs on the upper jawbone, which is called the maxilla. This picture right here is what it would look like if it were to grow on the upper part of your jawbone, the maxilla. It's basically just a bump under the gum, depending on where it's at, what location. When I was going through this process, my doctor, his name is Dr. Mark Reiser, he works for Aspire Surgical. He told me that ameloblastoma occurs equally in men and women. How it starts, basically, amel means enamel, and blastoma means germ. So when your teeth are developing when you're young, a piece of the enamel breaks off of your teeth and basically just starts growing somewhere else in your mouth. In my case, my tumor was down here, which is on the mandible. This is actually my x-ray. So right here you can see this black dot. That is what the tumor would look like. So depending on the location, it'll be in different spots, but this was actually mine. And then this is what it would look like under the microscope. This ridge around it is not supposed to be there. So some of the cause and effects. So some of the effects from ameloblastoma are face deformities and then pain along with numbness. So in my case, I didn't have any facial deformities. My tumor, he estimates, had been growing for about 3 years, and I looked exactly the same. Like we had no idea that it was growing in my face, and it was right up in the front. So if, for instance, I didn't have my tumor taken care of, it would keep growing. So that's what these images are. People in third world countries or people that don't have health insurance or access to doctors like this are forced to let these tumors keep growing, and this is what it would look like. And then along with the pain, it kind of feels like a toothache almost, but in the jawbone region. And I was also losing feeling in my lips, so that's how I caught it. But depending on the location, wherever the nerves are at, it depends. It's differently for everyone. Okay, so for treatment, there are many different treatment options depending on the type of tumor that you have. Most ameloblastomas are benign, which means they are not cancerous. The other 5% is cancerous, but that is very rare, even more rare than it already is. So the first treatment option is resection. So what a resection is just the removal of the location of the tumor. So that's what these images are. The red area is the amount of bone they would have to take out. So this little empty space is the location of the tumor. Then they have to go a certain distance away just to make sure that they have all the cells, just to make sure that they got anything and it won't come back, because it does have a fairly high recurrence rate. So these are also my pictures. They had to go at least 2 millimeters outside of the tumor just to make sure that they got everything, which meant they took out 9 teeth and about 5 inches of bone. So in that other 5% where it's not benign and it is cancerous, the treatment options would be something like radiation therapy or chemotherapy. Like I said, it is very rare. So this is a picture of what the resection would look like. These are mine as well. I'm sorry for the graphic images, but So this is the piece of the bone that they took out. There are the 9 teeth right there. And I pointed to it just so you could see it a little bit better, but the tumor is this little black area right here. It had actually grown through my tooth. So this was the inside, like by my tongue. You can see it coming through on both sides. So what they would do for the surgery, they would basically just cut the area open, depending on where it's at, the size, and they would just cut it out. You can see this is a tumor right here, and the nerve is growing over it. So they actually had to cut my nerve out because the tumor had eaten it and basically like destroyed it, like went through it. So I had to get a nerve graft and a bone graft, as well as a 3D printed titanium plate to reconstruct my face. This is what my x-ray looked like after my surgery. Again, this would vary depending on the location of the tumor. So you can see here, these white things are the titanium plates. There was 2, so there was one on the upper and then one below, just to help build my jawline back. They also did a bone graft and a nerve graft. There are many different options for this. This was the most advanced option with the least amount of recovery, we think, you know? Like I could have had the bone taken out of my leg or my hip, which is called a free flap. I personally didn't want to have that happen, so they wanted to try this, and it turned out successful. So they're recommending this surgery option for anyone that does have this disorder. So just a quick review. Ameloblastoma is a tumor that occurs anywhere in the jawbone region. Some of the cause and effects: facial deformities, and numbness. It's caused by enamel breaking off of your teeth when your body is developing. And then treatment options: resection, chemotherapy, and radiation therapy. And those are my sources. I hope you guys liked it.